There seems to be a lack of clarity about the Eastern Cape's vaccination plan. The provincial government says it plans to inoculate 3.7 million people in 9 months, but the National Health Department refuses to comment on this. To make things clearer, I'm joined by the acting head of the Eastern Cape Health Department, Sibongile Zungu. Thank you very much for joining us this afternoon. So we have those figures and timeframes from the Eastern Cape government, but national government says they can't confirm any of the details because their vaccination rollout plan is still a work in progress. So what are these numbers and timeframes based on?
Thank you very much and good afternoon. The numbers and timeframes that we have are guided by the articulations of the National Department around the estimated times and estimated numbers that have to be vaccinated. And we have taken our own provincial population and looked at the 67% of those. And we have then looked at exclusion of pregnant women and also exclusion of children that are under 18. And we have then started to look at the numbers and the estimates. And then we have looked at the phase one, which is healthcare workers. And we've used our PESAL system to look at the numbers that will be for the public sector. And then we've estimated again the numbers that would be in the private sector, in the private health facilities, the NGOs, the other health providers like campus clinics, health sciences students, and other employees that interact with patients in their various provisions of services, be it related to security at a health facility, catering at a health facility, or in some instances, those that walk in to do maintenance of technology within the hospitals.
So while the Eastern Cape government should be commended for being proactive, for putting planning in place and for communicating the plan to its people, that the timing may create distrust in the plan due to the fact that the Eastern Cape cannot plan in isolation of the national rollout. Are you prepared to re-strategize should rollout from national government necessitate changes on your part?
Definitely. Our plan is informed by the announcements that have been made nationally, and we will be guided by what comes through the National Department, the availability of the vaccine, and the National Department will be procuring the vaccine and distributing it to the provinces, and we will be guided by the availability of those resources from the National Department. From our side, what we are looking at is the ancillary supplies that would be required for the vaccine. And we are looking at different modalities of providing the vaccination processes, looking at the facilities that are available, looking at the transportation issues, looking at the issues that relate to the sites for vaccination, and looking at the available human resources that would require for doing the vaccination, amongst other things that we are looking at.
So you've identified 500 healthcare workers to carry out the task of vaccinating 67% of the Eastern Cape's population. Will those 500 healthcare workers be enough? And how many people will be required to be vaccinated per day to stick to your predicted timelines?
In terms of the numbers, we are looking at the number of 571 as an estimate. And again, we are looking at training people that are having a scope of practice that allows them to do a vaccine. And therefore, at a maximum, they can go up to 50 people in a day for vaccination. That is with the training, but also we've taken care of the process issues for vaccination relating to what happens at the site, the validation of the person to be vaccinated against the database that we would have pre-populated. And also we've looked at the process flow regarding the observation of the people that have been vaccinated in case there could be any adverse events, and also in view of the fact that we'll be doing the vaccination during the time of COVID-19 and the need for spaces and all of that. Those are the things that we are busy with at the moment.
Your communication around the rollout timing numbers is far more detailed than communication that we've received from national government to date. Do you think that that could create a problem down the line?
I don't really think it's a big problem. Ourselves as the Eastern Cape, we are aware of our resource constraints, and we have to start early to consider the details. And if there are changes that are made at a national level, it will be much easier for us if we have seen how far we are, or we have seen the gaps that we have, so that we can bring our gaps forward to be assisted in case there are gaps that we have. So we took it that because we understand our resource constraints, we understand the challenging topography that we have, we understand the challenges that we have with the access for our people, we will need to start looking at alternatives of ensuring that we have an equitable access to the vaccine, even to the most remote corners of the province, where access could be a challenge, where infrastructure could be a challenge. We need to start early thinking about these issues because we are not quite similar to most provinces in the country.
So communication around the vaccination rollout is absolutely key. We've seen a lot of vaccine hesitancy across South Africa, and part of that has to do with the kind of messaging or a lack of messaging that we've seen with regards to specifically vaccines. You've been saying that you're expecting to receive the AstraZeneca vaccine. Is that just for the first phase rollout to health workers, or are you assuming at this stage that the AstraZeneca vaccine will be rolled out provincially through phases 1 through 3?
The indication that we have had from the National Department is that the confirmed dosages that are available, the 1.5 million, is for AstraZeneca. And as the different doses become available, be it AstraZeneca or any other vaccine that the National Department would have procured, we would then prepare according to that. For now, we're preparing for phase 1. But again, because we are aware that phase 2 involves other government departments and other employment areas and people, vulnerable people that are above 60 and congregate settings within the province, we are also preparing for that, which is why in our province, that type of coordination is done from the Office of the Premier, because we need to be all-inclusive, working with civil society, working with our organized labor in the province to ensure that the frontline workers for phase 2 that are in other departments and in industries around the province are engaged and brought in time to identify who are first priority amongst those, and then we follow along the way. So we are not certain at this point whether we'll be using the AstraZeneca vaccine from phase 1 through to the third phase, or we will have another vaccine added along the way.
Well, thank you very much for all the clarification. That was the acting head of the Eastern Cape Health Department, Sibongile Zungu.